things that we understand people are going through at this time. And I'll finish with a few tips on what we can do to take care of ourselves in these difficult times. Under the circumstances, no matter what's going on, my wish and hope is that people can find a way of remaining happy even in the midst of this pandemic. Next slide. Yeah, so this is the outline of what we're going to do. So I'll spend a little bit of time just going through what COVID-19 is, because this is something that people sometimes we talk about a lot of things, but we need a framing of what we are talking about. And then I will go into the mental health consequences after that, looking at stress, distress, burnout, moral injury, because these are words that people use all the time, sometimes misusing them. And then after that, I will look at the mental health risks that are posed by this pandemic, and then look at the psychological reactions and the outcomes, and then go through some coping methods before I conclude. And so what this SARS-CoV-2 is the virus that causes COVID-19. That is how it looks like. Many times, many of us assume that everybody knows what a virus is and so on. So a virus is a thing that lives on the very edge of what a living thing is. The only thing that makes it like other living things is that it contains genetic material with which it replicates itself. And this genetic material, in the case of this virus, is called RNA. And then the RNA is protected by a coat of protein and fat. As you can see on the panel on the right, it is protected by this coat that has proteins and fat. And some of the proteins are those spiky things that make it look like a crown. And they're the ones that enable it to attach onto a cell and to get inside, as I'm going to show next. This virus is believed to have originated in bats and reached humans via animals called pangolins in somewhere in China or those parts of Asia. And then, so while they think pangolins, but then it's possible that some other intermediate host might have been involved. Next slide. The next slide summarizes what I have said. These viruses, the coronaviruses, move between animals and humans. And as it moves from the bat into the intermediate host, it learns to survive in the intermediate host by constant mutation. And those that mutate and are able to survive better in these animals then replicate and increase their numbers. And then it jumps into the next host and eventually gets to a human, where most of them will die off, but then a few of them learn how to survive in a human, and those are the ones that replicate, and then we start passing them from human to human. So that is the theory behind it. Next. Scientists have done work on the genetic code of this virus and compared it with other viruses that exist in bats, in pangolins, and so on. And they have found similarities, which are what led them to the conclusion that this virus originated perhaps in bats and went through an intermediate host and got to human. This slide, you don't need to understand much except to look at the similarities. If you look at the codes, these are just codes on the RNA. RNA is a sentence that tells a cell what to do, what proteins to make. And you can see the striking similarities between the human SARS-CoV virus and the bat virus, the pangolin version, and so on. And then the older SARS virus, with a few changes here and there that then enable it to survive in the next host. Next slide. And so when it gets into your body, this is what the virus does, and in very simple terms. Number one, it attaches using those spikes onto receptors on the cell surface, and this enables the cell to swallow it. And once it gets into the cell, then it opens up that bubble in which it went into the cell and releases that genetic material, the RNA. Some of the RNA will go and form what we call a replication complex, which is really an assembly line. And some of it will go into the cell's own factory down there, which is called the endoplasmic reticulum, and then start making copies of that, of the proteins that are coded for in that RNA. Once those proteins are made, they are assembled in that replication complex, and then they come back, and the virus is then reassembled, and then the RNA is put back into what has been assembled as a body, and then it is extruded in step number 6 outside the cell, ready to go and infect other cells. So that is really, in summary, what this virus is. Next, we are looking at the epidemiology of this virus in very brief. The first case, as everybody knows, was reported in Wuhan, China at the end of 2019. But it is thought to have been circulating in the population since the last quarter of 2019, based on how it is behaving now. At the moment, as at yesterday, I think around 12 million people had been confirmed to be infected. Obviously, probably more are infected, but then these are the ones who have been tested and confirmed, and about 548,000 deaths worldwide. In Kenya yesterday, we had 8,525 confirmed cases with 169 deaths, and several thousand who have recovered. Now, I'll look at a few terms, starting with stress, because many of us say, oh, I'm stressed, and so on and so forth. But it is important for us to know what these terms mean. So stress is that tension you experience when you encounter a threat and your coping resources are inadequate. It can be positive when you're a bit stressed and it spurs you to act to deal with the situation or find a way of avoiding it. But it can also be negative when it induces responses that are maladaptive, that cause you harm. And the effects of stress are in that panel on the right. It affects your entire body, whether it is concentration, headaches, anxiety, anger. It causes physical problems like stomach pain, fatigue, decreased sex drive, skin irritation, muscle tension, and so on and so forth. So stress affects you as a person completely. Fully. The next slide, we are looking at the term distress. Distress is a subjective sense of discomfort that ranges from normal feelings of vulnerability, especially when you are in a threatening environment as we find ourselves in right now, feelings of sadness and fears, to problems that can become disabling, such as depression, anxiety, extensive worry that doesn't allow you to do anything else, negative thoughts, or social isolation. So you find that you're keeping to yourself a lot. The next term that I would like, which I've had many people, especially professionals, talk about is burnout. We describe burnout as a state of emotional, physical, and mental exhaustion that is caused by prolonged exposure to excessive stress. And when one gets extremely overwhelmed and is unable to meet occupational, social, or other demands, we consider them to have been burnt out. So when you're burnt out, it denotes a sense of emptiness, that you have nothing more, nothing left to give. And so that's where the term comes out. It's like a candle has burnt out. There's nothing more for the candle to give. Next, I'll look at a related concept of moral injury. And this is common among people in the helping professions or in the military or in the police. And it refers to injury to one's moral values and conscience due to a perceived moral transgression. So if you find a nurse working in an ICU where people are dying and she does not have the resources required to save those lives, and it goes on and on and on, she reaches a place where she feels like, what am I doing? It produces profound guilt and shame, and may also cause feelings of betrayal, anger, and moral disorientation. What's going on in the world around me? And there are several facets, as you'll see in the panel on the right, where we have emotional features like shame, guilt, anger, contempt, loss of honor, loss of joy. You have relationship issues with loss of trust, severed ties, disconnection, and so on. There are changes in your self-concept, where you start looking at yourself as not being as good as you thought you were. You can't be trusted, you're a failure. And in your concept of the world, where you start questioning your religious or spiritual values, issues to do with goodness, meaning of life, and so on. And eventually you start finding that you lose this sense of authority over yourself. You are unable to calm down. You're constantly, strung out, lose self-control, impulsive, and so on. And finally, the continuity over time. So this feeling, you get basically dislocated and you do not know where you are at any given time. So these are things that all of us are experiencing, those of us who are on the front line, and even people who are helping with controlling this pandemic, including the security forces, including people in the media. When you're being made to do things that you find don't really gel with what you believe to be right. Next, I'm going to look at some of the risks, mental health risks that are associated with COVID-19. And this is why COVID-19 is a huge risk to our mental health. Firstly, there are so many unknowns. Even now, 7 months into the pandemic, we still do not know, we are still arguing about how it is spread, how it can be prevented, how it can be best managed. There's no country that has the best way of dealing with it because the virus is still spreading in all countries in the world. It's an unseen threat. It's a widespread infection. You don't know who is infected. Everybody can be affected. And interestingly, there's a rapid spread of information. When something happens in the US today, it is in Mongolia in the next minute, and everybody gets to find out what's happening everywhere. And as a result, therefore, there is widespread misinformation. So the misinformation rides on the information that is going out. People twist facts that are being spread out. People present opinions as facts, and people start, reacting to that misinformation. Another problem with this virus is that we are seeing evidence of nervous system involvement. It causes, there are many people who are reporting problems with concentration, memory, emotional control, and so on as a result of this viral infection. Another factor is illness and death of loved ones. So when somebody close to you gets sick, severely ill, or dies, this affects your mental health. And health workers and other first responders are facing significant risks related to this pandemic as well. Another thing that is causing risks to mental health is isolation due to the control measures that have been put in place to control this pandemic, and also overzealous enforcement, as we saw in the first days in this country when police were, using a lot of force to deal with the pandemic. There are also socioeconomic effects, including job losses, reduced income, and the narrowed social support network that is coming with the response to this pandemic. Then there are close interactions with family, and we have seen reports now of increased sexual and gender-based violence and intimate partner violence, and basically just domestic unrest as a result of control measures that have resulted in people spending a lot of time together and therefore learning some of the bad things that happen with their family members. And so this is causing a lot of problems. Now, having faced these risks, what are some of the reactions that we are seeing in the population? A lot of reports that we are looking at are presenting people saying they're anxious. There's a lot of self-reported stress. People are stressed about many things, including job losses, including reduced income, family problems, the illness itself, and so on. There's a lot of fear. And fear produces many reactions in people. It might help people to take precautions to protect themselves, but on the extreme, this fear can cause people to become reckless and to stop worrying about the future, and therefore to put themselves and put others at risk. There's lots of uncertainty given the fact that we do not know enough about this virus for us to be able to deal with it. There's a lot of irritability and anger, and you will see this every time there's a new proclamation by government. There'll be very angry reactions. For instance, when they were reopening the economy the other day, there were very many angry voices on both sides, people saying, yeah, let the economy be reopened so that everybody can have enough to take care of themselves. And on the other hand, people saying, this is reckless. Why would you do this? You don't care about us. And there's feelings of grief, which is, in my view, an important component of this reaction. And I'll spend a little bit of time on that. And it may trigger pre-existing mental illnesses among people who have depression, who have anxiety, or who have other mental illnesses as well. So I'll spend a little bit of time describing grief. And grief is something that has been studied for a long time, beginning with the work by a pioneer called Elizabeth Kubler-Ross, in which she framed, first of all, the stages of dying, but these were later modified into stages of grief, because we realize that everybody goes through this when they face significant changes in their life or losses. And the first stage would be shock and denial, followed by anger, as we have seen, stage of dialogue and bargaining, depression and detachment, and eventually reaching a stage of acceptance. And recently, people have extended this work and said, you go through these stages in order to arrive at a place where you find growth, find meaning out of a loss that happens to you. On the panel on the right, you'll see the stages and how it goes. And the reason why it is convoluted like that is that it is not a linear process. You don't have to move from shock to anger to depression to dialogue and bargaining to acceptance. You can go forward and backward among those stages before you reach to a place where you find meaning in your life. So this is really just framing what grief is, and we will come back to that later to see how you deal with these stages in our population. Now, what are some of the psychiatric manifestations that we are seeing? We are seeing a lot of depression. People who are vulnerable to depression are now getting the depressive episodes during this time. Their access to care is limited. We are seeing people with anxiety disorders, especially panic disorders, the phobias. Many people have suggested that obsessive compulsive disorder can, given the control measures that we have said, people should wash their hands a lot more and maintain hygiene and do certain things that seem to exacerbate or to feed off the OCD traits. We have a lot of substance use happening around here across the entire population. There are people who have mania or psychotic episodes which are now happening at this time, again related to problems with access to care, but also just because of the stress of the situation. Adjustment disorder, post-traumatic stress disorder, and other trauma-related disorders are also increasing in the population. People with developmental disorders, including children with ADHD, autistic spectrum disorder, these are being exacerbated now because of the restrictions and the fears that are associated with what we are going through. And finally, the virus itself might be affecting the brain, as I indicated earlier, causing effects like delirium and other illnesses that are related to direct effects on the brain. As I go towards the conclusion, I want to look at how do we deal with these effects that I have mentioned. And one of the things that we need to do is psychological first aid. And this, everybody can do psychological first aid. You don't have to be an expert. You don't have to be a health worker. Anybody who is in a position to help can learn how to provide psychological first aid. It is focused on ensuring that people's daily needs are met. They get the information they need in order to protect themselves and others, and they're protected from information overload, and then they're linked to care. For frontline health workers and other disciplined formations, debriefing might be useful because it addresses their fears and anxieties, helps them to discuss distressing incidents, and gives them a sense of community and connectedness so that they are readier to face the next day. And it's important for us to all find reasons to be hopeful. The panel on the right shows you some of the things you need to do as part of psychological first aid. Most importantly is listening, be there and listen, comforting, providing comfort to people who are in trouble, connecting them, especially connecting them, protecting those who need to be protected, instilling hope, and taking care of basic needs of the people. And next, very quickly, I show you how to help people in the various stages of grief. And I think this slide will be shared, so you'll be able to get it and go through it. And if there's nothing else you pick from this entire presentation, I think this is useful because all of us are in varying stages of grief and we experience this grief over and over again. But I will just highlight how to help someone in the various stages. So somebody in denial requires accurate information. It is pointless to argue endlessly with somebody who is in denial. It is more useful to provide information in bite-sized chunks so that over time they start understanding what's going on, and they are able to increase their knowledge and develop adaptive coping mechanisms. Somebody who has reached a stage of anger, it is important to allow them an opportunity to speak in a safe environment, to examine their own anger, and to redirect that energy in order to process the loss and incorporate it into memory. Somebody who is in a stage of bargaining, they require a supportive environment, a listening ear, and the ability to explore various coping strategies so that they stop, looking at impossible things and start developing adaptive coping mechanisms. Somebody who is in depression would require a shoulder to cry on and support in coping. So you need to be there for them, help them to explore life after this loss in order for them to reach a stage where they accept the loss and start planning for the future. And somebody who has reached a stage of acceptance, you support them in that process, help them to consolidate the lessons learned, concretize and implement plans for the future with the goal of growing and finding meaning, even in this time of loss. Finally, some quick do's and don'ts for coping with stress in this time. The do's are, I think, self-explanatory. Get information from trusted sources. There are multiple sources on the internet, as there have always been. A significant proportion of them contain misinformation. So you need to identify trusted. If you want to get health information, get it from health experts, I think, and health institutions that are established. Maintain connection with your social supports. Do not cut off connection, because it is very important for humans to remain in touch. Look for reasons to be happy. Eat well, sleep well, get plenty of rest. Do physical and mental exercises to keep yourself going. Importantly, be helpful. Find something to do during this difficult time to help other people. Be kind. I think this is something that I can't say enough of. Everybody is going through a tough time. It is not nice to be unkind to people when you don't know what journey they have traveled to get where they are. Do not use substances to cope, and I have indicated that, because if every time you're stressed, you're going to use alcohol, tobacco, stimulants, bangi, whatever it is, then you are compounding the problem. Do not fear seeking help when in need. Do not overindulge in the things that we say you do in order to cope, like sleeping, food, and so on, because again, there are health risks. Do not focus too much on tracking COVID-19. It's okay to get an update once a day. Don't overwork. Many people are at home, working from home and so on. And you think that because you're at home, you can do more work than you usually do when you go to work. Do not. I think keep your working hours, make time for yourself, make time for your family, make time for recreation. Do not take on responsibilities that belong to other people or worry about things you cannot solve. You are not going to sort it out. You're not, Atlas, you're not carrying the world on your shoulders. And the last slide is really just to help you look at the mental health continuum from healthy on the green side to a yellow, which is now we are reacting, to this orange where you're now injured, to the red zone where you are ill. And I have indicated there some of the things that will give you a warning when you're getting away from the healthy, where you have normal fluctuations, the normal lifestyle, going towards nervousness, trouble sleeping, you're starting to get into trouble, to stages where you're now anxious, angry, sleep is not there, fatigue constant, and so on, to stages where the anxiety is excessive, unable to fall asleep, you're isolating yourself, and you're sick. Some of the actions that you need to take are below on that bottom panel. When you're healthy, continue being healthy. Do everything that we have said that will help you to be healthy. When you're starting to react, you need to recognize your limits, get adequate rest, food, sleep, and so on. When you're starting to get injured, identify and understand why. Talk to someone, seek help, seek support. And when you're ill on this other end of the spectrum, find a professional to help you and follow the recommendations that they give you. I'm going to stop there, and thank you very much for listening, and I will be ready to take questions after this. Thank you.
All right, thank you so much, Prof, for that presentation. Now we are in a position to better understand what exactly is going on as far as mental health is concerned. So even as we try to manage ourselves with the new measures that have been put in place to flatten the curve, let us be on the lookout. Let us just monitor ourselves as well as we take care of our physical health. Let us also monitor ourselves to notice any changes that might be in line with our mental health, and also take action as soon as possible based on the recommendations Prof has given us. Because again, the pandemic is here with us. We don't know when it's going to go away. So we have to keep hope alive. And I mean, keeping hope alive is of great help. And it will help us one day at a time. And as these things, as we face them, we just face the reality that it is here. And mental health is real. Mental health issues are real. And you might not know that you're going through it. But based on this conversation we are having today, at least we are getting a clearer picture. And even as we hang around our colleagues and friends, we can easily identify a few of us who are going through such things, and we can reach out and try to help. Overall, be a listening ear, give comfort where necessary. So Prof has given us from a general population angle. So Dr. Joy will give us a perspective from the frontline workers, because they're going through a lot. And I was speaking to her yesterday, and she was telling me that, for instance, if you're working a whole week, then you have to, when you're taking your day out, you have to be on 2 weeks quarantine before you go back. So finding a balance between work, self-isolation, and family can be a challenge. And of course, as we are, well, from wherever we are working, we are going through these things. You can imagine those who are actually on the ground witnessing what is actually happening. The videos we are seeing online, they're actually seeing them live. So it's not online videos they're watching. They're seeing patients die and they don't know what to do. They're trying to reach out to people and trying to encourage us to be safe. And it's a handful probably for them. So Dr. Joy will come and speak to us and tell us, for the methods in the front line, what is it that they can do, and what are some of the things that are in place to ensure that they still keep their mental health in check, even as they try to help us deal with this pandemic. So Dr. Joy, you have 15 minutes. Thank you.
Much, Irene. I appreciate being here today. I'm loading up my presentation. We appreciate to be here presenting about the Health Workers Wellness Program. I'm Dr. Joy Mugambi, a family physician in Baringo and the Assistant Secretary General, Kenya Medical Association. My prof has spoken quite elaborately about what mental health issues are all about. I'll speak about what we as an association and in partnership with other health organizations have done to ensure that health workers are cared for and the health workers' mental health is considered as they work to ensure that they bring to you the best in terms of healthcare. KMA Physician Wellness Program started all the way in 2016. It was activated during one of our AGMs in Kisumu, where we noted that quite a number of doctors were falling ill, a number had passed away due to chronic diseases, and we asked ourselves as health workers, we don't consume what we give others, and how can we help each other be able to reach the health care that we keep giving others and ensure that it is of quality. In 2017, the doctors' strike came up. A lot of suicide, litigation, ill health was experienced during this time. And this is the time when we had a lot going on in the physician wellness program, and we linked quite a number of young doctors and older doctors also to care amongst ourselves. In 2018, a number of young doctors experienced unemployment. This is the time when automatic employment by the government went away, and a number of doctors were not now being taken up, and the private health facilities were also not employing. So a number experienced lots of mental health issues, but the physician wellness program came handy at that point. In 2019, we have experienced a lot of health workers who are experiencing burnout, compassion fatigue due to the reduced human resource within our facilities. And since health workers are not being employed and we are experiencing, someone brought down my PowerPoint, but I'll bring it back. And we are experiencing a lot of health workers who are burnt out. Then we brought in the physician wellness program, which has served as a key component in terms of health and welfare. So at the workplaces, you note that most workplaces do a program that takes care of their health workers, as much as the association was offering something. In 2020, the pandemic struck. And when the pandemic struck, health workers needed to be assisted in one way or another. So in 2020, when the pandemic struck, yes, we were hearing a lot of news from other countries in terms of how many health workers have died. There was a lot of fear, anxiety amongst the health workers. Then came the travelers who were being quarantined, and health workers had to man quarantine centers. Imagine sleeping in quarantine centers with people you do not know their status. The numbers that were in those dorms that you had to control, you had to ensure that they are not passing infection from one person to the other, was overwhelming. Many of the health workers got so overwhelmed with the quarantine situation. Then came the COVID cases in the hospitals. And this was another key area because the disease was new. Many people did not understand how to manage it, but we had to ensure that the people who are coming in were taken care of. So fear, anxiety, depression, and burnout and compassion fatigue started setting in. We felt as an organization we needed to escalate this. And as much as we would care for the physicians, what about the nurses? What about the clinical officers? We are all working as a team in the facility. So we set up the healthcare wellness program, which is set out to take care of all health workers in the facility and also reach out to their families and be able to ensure that they are well taken care of. Death was also another key area that we had to sort out when dealing with the pandemic. There was lots of deaths in the ICU. Those who are dealing with the ICU cases saw death. Those who are in the rural facilities had to oversee burials and carry those coffins in all these hazmat suits. So it's been a critical area that health workers are coming in burnt out and having suffered a lot of mental ill health. So on 8th April, we started a partnership. I put this as a tree that has been planted in terms of healthcare. It's the first time in the history of healthcare that mental health amongst health workers is being taken seriously. And with that, we partnered with the Kenya Psychiatric Association, the Clinical Association, the Clinical Psychiatric Association of Kenya, the National Nurses Association of Kenya, and the Clinical Officers Association of Kenya, along with the other associations which deal with healthcare workers. This partnership brought out a number of things. As we were assessing our health workers, our thought was, yes, they are burnt out. They are coming in distressed due to burnout, stigma, substance abuse, financial hardships, fear, anxiety, and distress, grief and loss, Family violence, many have faced partners in gender-based violence. The children are home. Our children are home. We have to care for them. Most of us have even lost our own support that our domestic care support that we usually have. We've got partners who were locked out in other counties during the lockdowns. So you end up finding you're a health worker, you're taking care of the patients in the ward, you have your children at home, some of them are very small, and you have to work. And your mental health issues need to be taken care of. So we came together to offer psychosocial support and interventions, and we hope as our healthcare workers get out on the other side, they get out when they are much happier and they are able to provide services to the general population when they are healthy mentally and physically. So our wellness program is outlined as follows. We did a baseline survey, and this was conducted by one of our members who's at the MTRH. She drew out a baseline survey, which is to assess the problems that healthcare workers are facing. The results are yet to be out, but we have some few preliminaries that advised us on the second step, which is the webinars. The webinars were meant to educate and inform health workers on the various interventions that are there and the various conditions that are there. One, to be able to sort out their own mental health issues, and two, to be able to also address mental health issues of their clients that they are seeing, because there is a large gap in terms of the psychiatric and psychologists in this country. So every health worker needed to be in the same page, and these webinars have really helped. That strategy in terms of the health workers' wellness was to set up a call center. We are glad to say we currently have a call center. Our aim was to have it running for 24 hours. So we have initially started with 8 hours, and as much as the calls come in, we will be able to address and see how many more hours we add in to ensure that we cater for all health workers. Our fourth strategy is to set up virtual group sessions, which we aim to start as of next week, which are meant to be debrief sessions for groups. We also aim to take our health workers through psychological first aid sessions, which Prof has spoken very well about. And we are open also to organizations that are willing to be trained on this so that they can assist their colleagues as they go about. Mindfulness sessions in terms of how to be able to also go through meditations if you're open to that, and various other relaxation techniques, which our psychologists and our psychiatrists will take our staff through. Our webinars. We've currently done 10 webinars on various topics, and we are still going on with various other topics that we are conducting, from anxiety to children's mental health and wellness, because health workers said they want to know how to deal with their children's mental health and wellness, vicarious trauma, gender-based violence and stigma, which most of our health workers are really facing, stress, distress, and depression. Which one are you facing? This was a very great session. Loss and grief, substance abuse, post-traumatic stress disorder, compassion fatigue, and we are still going on with these sessions. These sessions can be found on our Facebook page and our YouTube site. The call center. The call center was launched on the 25th June, and we now have 10 toll-free lines which health workers can access. We have 2 nurse counselors, 2 mental health clinical officers, and 2 clinical psychologists, and 2 psychiatrists. We have also added 2 medical students. Medical students are currently at home on holidays, basically at home because education is not going on. But we want to mentor them. We want to ensure that they know how to handle situations like this in future. So we've included them within this mental health and wellness program. So the call center processes, we take general calls, and these are received by the medical students who have been guided by an SOP. And then if they need to hand over to someone, the general calls could be something that they could sort out through the SOPs, but they can hand over the client to the counselors or the clinical officer, the nurse counselor or the clinical officer mental health. And if once the clinical officer mental health take these clients through the PFA and the relaxation techniques, and they feel that these clients need to see a clinical psychologist, they refer to the clinical psychologist to offer psychosocial interventions and further follow-up if they need a one-on-one session. We have linked psychologists who are in various counties, and we are able to refer our health workers to the nearest psychologist or psychiatrist based on needs if there is urgent need for them to be seen on a one-on-one session. Our clinical psychologists have the opportunity also to refer to the consultant psychiatrist, and an intervention set out or therapeutics or a referral to an institution is done based on what they find out. So for more information, we have our Facebook page, which has most of these sessions that were carried out. And these sessions have not just been beneficial for health workers because they cut across in terms of all, in terms of the general population and various work situations that most of us face. They are not so technical. You can check them out on our Facebook page. We also have, for health workers, a lot of resources on our KMA website, which are geared towards COVID-19 and other learning platforms on the back end for members. And our toll-free line is as follows: 0800, sorry, I cannot see the complete, 720608. So reach out if you're a health worker between 8 to 6 p.m. and let us help you. For once in the history of healthcare in Kenya, we have a wellness program for us, made by us. So reach out and we will be of help. And we are open to other institutions that would like to set up a health and wellness program. We can assist and we can be able to be of help. Thank you.
All right, thank you so much, Dr. Joy, for that presentation and for just reminding us that, the frontline workers are also being taken care of. Yes, we are aware about the center that was set up at KNH, and we hope that the frontline workers, the healthcare workers, won't be shy to come out, because at the end of the day, if you need help, you need help. And there are people who are willing to reach out and to help you through, and we all need each other during this pandemic. So we are glad that something is being done to help the frontline workers, because we need them same just to make sure that we are healthy, and as we try to flatten the curve, they're also there to help us when we need their help. So a very quick reminder, we'll be going through the plenary session now. If you have any question for the panelists, please feel free to type it in on the chat box, and we will be able to have them respond to the questions. And also, if you feel you can't type it, there is you can use the hand raising tool that is on your screen, and we will be able to see it, and we'll give you an opportunity to ask your questions. I don't know if anybody has a question for our panelists today, because now we are moving to the Q&A session. So anyone with a question before we allow them to give their closing remarks and close for the morning. can see somebody has typed. So Mercy has a question for Dr. Lukoe, and her question is, Doc, how would you advise to handle a person who has lost their brother to suicide? So yes, we are having a discussion about COVID-19, but feel free, we are here for each other today. We are not discussing economics, we are not discussing, so we just want to have a very open and genuine conversation. So feel free to ask any mental related question that you might have. It must not be related to COVID-19. It might be a personal relationship. It might be, like Mercy is rightly putting, a suicide within the family. Any question relating to mental health, we give an opportunity, and the good doctors here today will offer free consultation for today. So feel free to bring on those questions. So Doc, you can have the opportunity to respond to that as we look at the other questions.
Yeah, thank you very much. Yeah, unfortunately, suicide is one of the things that happens at the end of the distress that is caused by mental health and psychological problems, and the rates are really high, and Kenya is one of the countries with high rates of suicide in the world. So when somebody in the family dies by suicide, I think it is important for people to appreciate that often it's not the fault of those that remained behind. I would say that unless you are an expert in mental health, even experts in mental health often miss signs that somebody is thinking of killing themselves. And so one of the things that happens in families is that people start asking, what could I have done to prevent this? And often I can tell you the answer is that there's very little you could have done as an individual because you did not know. And then the other thing is to start asking yourself, if this person who looked so well put together, who didn't seem to have any problems, can get to a place where they kill themselves, what about the rest of us? And the answer to that is, it is important that if you start feeling like you're getting overwhelmed, you're starting to have those kinds of feelings like life is not worth living, there's no hope in the future, and that you'd be better off dead, then it is important to get in touch with a professional who will help you to deal with the things that are causing those feelings to come along. So in Kenya, one of the problems in the country is that people don't talk a lot about this. And one of the things is that we have criminalized it, so that if somebody tries to kill themselves, we want to take it through the legal justice system. This is one of the things that we are fighting to decriminalize, so that when somebody feels like killing themselves, we acknowledge those feelings, but then we provide help to deal with the reason behind those feelings, so that the person can continue to enjoy their life and live like everyone else. In fact, in the mental health task force report that was launched just the other day, we recommend decriminalization of suicide, and we recommend that we set up suicide prevention programs that will then help people with information and resources to reduce the rate of suicide in this country. So I think there is help available, and even for family members of somebody who has died by suicide, there is help available. They can get counseling support. They can get real support to deal with the feelings of grief and emotional distress that arise from these kinds of loss.
Thank you so much, Prof, for that response. And so we'll take another round. Somebody is asking Professor Lukoe to tell us just a bit more about the anxiety disorder and how to deal with it. And Dr. Joy, you can respond to, somebody wants to understand that, fine, we have set up this center for the healthcare workers. Are they actually using it? Are they? Do we have healthcare workers who are calling for help? And yeah, and then for Dr. Lukoe, again, somebody is asking: is it wise to lie to someone if at all it might make them feel better about themselves? That if it might boost their self-esteem. It's a general question. Is there any genetic link in psychological problems? Say if your family had members contemplating suicide or feeling worthless, that your kids might as well suffer the same. Shell Smith also wants to understand, he appreciates the good presentations that you have made, the both, and he wants to understand, yes, he notes there is increased mental issues. What is the government doing to increase the public mental care facilities, which are very few in the country? So I think Dr. Joy and Professor Luque can both respond to that. And finally, as we wait for the other round, is how does one deal with anxiety caused by increasingly alarming news on COVID-19, especially for children who are also trapped in the news cycles? So if we can have you respond to those as we wait for the other questions. So I'll start with Dr. Joy and then Professor Luque. So Dr. Joy?
Thank you very much, Winnie. Yes, the call center is being used, and also other mechanisms that we have had previously. Before we had the call center, we've received a number of calls that our health workers needed help. Yes, we are using it.
Okay. All right. I think there were a number of questions that I will try and address. One is a general question about anxiety disorders. And anxiety disorders are psychological problems or mental disorders that are related to fear, to the sense of fear. And usually it is either exaggerated fear, you have an exaggerated fear response to something that is actually out there, or sometimes you have unexplained fear and a sense of worry that cannot be tied down to any specific reason. And these disorders, there are many, and there are very many people. They are among the most common disorders anywhere. And in fact, statistics in Kenya show that most people presenting with mental problems will have an anxiety disorder. You know, some estimates have put it as up to 4 out of 10 people experiencing symptoms of anxiety disorder in their lifetime. These include, you know, panic disorder. They include generalized anxiety disorder, where you just have a general sense of unease. They include disorders that used to be classified as anxiety disorder, but now we call them trauma-related disorders like post-traumatic stress disorder, and so on and so forth. The key thing is that today, most health workers are trained to be able to recognize these problems and to start providing some basic care for people with these problems, as well as you know, linking them to more professional care along the continuum. Is it okay to lie to someone if it might boost their self-esteem? I think lying to somebody, even if you think you're trying to help, is very troublesome. And it is troublesome because once you release a lie and you want to maintain consistency, then you probably have to keep the lies that you're telling in order that you know, you maintain some sense of consistency. And that's a lot of work. And often it doesn't help the person you think it is helping, because eventually they will find out the truth, and then they will find out that you lied to them, and this just compounds the problem. So I do not think it is okay to lie to someone. If you think that telling somebody something will cause increased distress, then it might be useful to find a less distressing way of making them aware of what is going on. So using language that is less distressing, using you know, settings that are less distressing, and if it is very difficult or impossible to do so, then finding experts, mental health experts who are trained in giving bad news in a way that doesn't increase the distress, but in a way that increases the support a person needs. Are there any genetic links to these mental disorders and psychological problems? The truth is that these conditions are multifactorial, if I may say so. They're caused by many things, and there's no one thing that you can point to and say, this is the only thing that caused this problem for this particular individual. The first set of causes, we classify them as biological, broadly speaking. And biological causes include genetics. So the genes that you're born with determine what you are at risk of getting. So the genes determine vulnerability. whether you'll be at high risk of getting depression, high risk of getting an anxiety disorder, even high risk of getting diabetes, hypertension, and so on. So the genes determine that kind of vulnerability to some extent, but they don't, in mental health, they don't necessarily confer a definite risk to say that if you have this gene, then you're going to get this disorder. No, they just demonstrate to us, we can calculate that maybe you're 20% increased risk compared to other people, maybe 40%, 50% increased risk. Then other biological factors include the environment in which you grew up in the womb, what was happening with your mother, what was happening in your home environment, and what happened at birth, whether it was a normal delivery or it was complicated, whether you had problems breathing when you were born, and goes all the way to your early childhood, whether you had infections, whether you had head injury, and so on, and then all the way into your adult life, including if you're taking things that are affecting your brain functioning. All those are biological factors. The next set of factors are what we call psychological factors. And psychological factors turn around your disposition, your personality especially, which determines how much degree of resilience, how much can you take before you break. And then finally, we look at the social factors. And the social factors determine often when an illness is going to occur, if it is going to occur, and they also determine whether you'll get better once you get the illness. This include the kind of family that you have, the kind of friends, your social support network, whether you have a job or not, your socioeconomic status, the neighborhood you live in, its cleanliness, environment, and so on and so forth. So all these factors continue interacting with each other to determine if you will get an illness, when you will get an illness, and what happens after you get that illness. And genetics is just one component of those factors. What is the government doing? I cannot claim to speak for the government. However, in the task force report that we presented to the minister, at the time when we presented it to the minister and the principal secretary, we had discussions around its implementation. And the minister himself committed and said that from day one, they are going to start putting in place measures to implement the recommendations of this task force. The principal secretary has committed herself and said she has a personal interest to ensure that the mental health of Kenyans is improved, and we have given them the tools to use to do that. Now, if the government doesn't do what they're supposed to do, the task force report is publicly available, and you can hold the government to account by asking them why they're not doing it, because now they know what exactly they need to do in order to start addressing the problems of mental health in this country. So that tool is available. It's on the Ministry of Health website. It's on social media, and people can use it for advocacy and to hold the government to account. Finally, dealing with anxiety due to the alarming news and information overload, if you like, what I would suggest is that you have your own program in a day relating to COVID-19. First of all, take all the precautions that have been advised by the Ministry of Health and the World Health Organization. Take all the precautions. Secondly, decide how much information you want to be exposed to, and you can decide when you want to be exposed to that information. It is within your control. You can decide, I'll be looking out for COVID-19 updates once a day or twice a day, and this is the kind of information I'll be looking out for. You can even decide what kind of information you'll be looking out for, and you can decide which source of information you'll be going to once a day just to know what's going on with COVID-19. The rest of the day, please focus on your daily life, focus on earning your livelihood, focus on taking care of your family and of yourself, link up with friends, and do the things that you would be doing even if COVID-19 was not there.
All right, thank you so much, Prof, for that, for the Prof and Dr. Joy for the response. So we have two other questions, and Kwame is asking, and it's a general question to both panelists. So he wants to understand, of course, COVID-19 emergency has demonstrated the severe shortage of medical professionals and specifically physicians. What explains the low intake of students in the medical schools in Kenya? And we have Celine, who wants to understand, she has a comment and she appreciates the good presentations made, and she asks, Her concern is based on lack of government actions and policy interventions that should complement supportive and coping mechanisms for individuals during the pandemic. Specifically, the government recently listed alcohol and tobacco as essential products for COVID, whereas evidence has shown that smoking can lead to serious illnesses from the virus and even death. So this is the time that the government should discourage use of such substances. I think that's just a comment, and you can just comment about it. And then Joyce is asking, how would you advise one to go about encouraging men to speak up and reach out for help? How can we motivate them to be emotionally expressive as opposed to the usual macho stance that they take, often repressing their emotions, yet they are going through certain issues? So, and we have Davis who wants to, how do I help a roommate who is having anxiety, fear, and depression? How do you support friends? How do we support friends around us? Sometimes just speaking to them doesn't help. And the Duke is asking, what can we as a society do to make seeking for help to be accepted and not stigmatized? Instead of the usual that being a man is to be tough and tackling your issues alone is a sign of strength. And then Jimmy, Prof didn't handle the aspect of anxiety in children, or was that a general response? So we can have Dr. Joy respond to any of the questions, and then Prof can come in and also respond to those that have been directly put to him.
I'll respond to what has been asked in terms of training of physicians. Yes, the training goes on, but the slots are few. Being released from your workstation is also a big challenge because, yes, human resource is in small numbers, but there is need to upscale the numbers going into training. There is positions, yes, but not everyone can get into the training positions. There is a number of doctors who are not employed, and that makes also the human resource gap. I'll throw this back also to Prof because he has been a dean. He knows more about training and the gaps that are there. And I think he's better positioned to take that question up. In terms of children, anxiety in children, I think it also falls that there is opportunity to run another session for children. Though Prof will be able to share more about anxiety in children and be able to highlight that. Thank you.
Yeah, thank you very much, Joy. And I love the questions. Thank you very much. I will also reiterate on the severe shortage of professionals. Firstly, there's no, to begin with the lower level of doctors, yes, there is a shortage of doctors in the real sense that there are very few. However, every year we are registering about 1,000 new doctors in Kenya every year. Many of them trained locally, but some of them trained abroad. So that's a large number. The problem is most of them are not getting employed. Most of them are floating out there looking for work. So the government stopped employing health workers in general, both at the national and the county level. The numbers that are being recruited are very few, and that is contributing to the actual shortage of human resources for health in the public sector workplaces. Now, for specialized doctors, the slots are indeed limited for training people now in specialized areas of medicine, surgery, pediatrics, mental health, and so on. And this is basically because only 2 or 3 universities in Kenya now are providing postgraduate training in medicine. This is going to improve with time as more and more institutions start these programs, as well as a collegiate training program that utilizes the facilities where they are working for them to be able to be trained. There's a lot of problems between coordinating between county and national governments when it comes to training of these doctors and other health workers. And this has taken a long time to be smoothed over. It is not working. And there have been suggestions that having a health service commission to put all this together, where they do a needs assessment, they do the recruitment and deployment across the country based on need, and they also identify training needs and send out those who need to be trained in a rational way that ensures the service is not disrupted across the country, that this might be one of the solutions for this problem. About the government and its the problems with coordination in government, like a good example actually, which has been cited, of listing tobacco and alcohol as essential commodities. Yeah, I agree that this looks like the left hand not knowing what the right hand is doing. We in the health sector are saying that one of the things that we can achieve in our lifetime is to eliminate tobacco use from our communities. And we have no apologies to make. If tobacco companies close shop, if people stop growing tobacco, the world will be a healthier place to live in. And after we deal with tobacco, then we probably will be shifting, and we're already talking about the risks and harms due to alcohol use, the risks and harms due to refined sugars in our food and so on. And those are all areas that we in the health sector are advocating that people start taking a closer look. So government should be supporting that by restricting the supply of tobacco, restricting the usage of these harmful substances, including alcohol and other substances. Men, this is a common problem that men get psychological problems, have difficulties talking about it. I think one of the reasons is our cultural setup that says the definition of a man is a strong person. I'm here to tell you today that a man is a human being, is the other half of human beings, where we have women on the other half, and they experience the same challenges, they experience the same distress, and they are vulnerable just like the women folk. And often, because of, again, our patriarchal society, where we have huge demands on what a man must do in relationships. A man must make the first move, a man must never cry, a man must always be stoic, and so on. These demands, especially on men who are vulnerable to mental health problems, these demands are often the trigger that drives them over the edge. So we will need, as a society, to change our perception of what being a man is, to look at men as human beings who have certain gender roles, which is fine, but then who also are just as vulnerable as women when it comes to mental ill health. And we should have services that are available to them that are not judging, to say that, oh, you're a man and you've been crying. We shouldn't have services that judge like that. So our health services also need to reconfigure themselves to be welcoming to everyone who comes and needs assistance. But my message is even men break. And in fact, in certain instances, men break more than women. Men are just as fragile, sometimes in certain circumstances, more fragile than women. And we have to be to realize that fact and ensure that people are able to access help when they need it. Somebody has asked about a roommate with anxiety, fear, and depression. I agree that when things have reached a certain point where the symptoms are so severe, they are interfering with the daily functioning of a person, then just talking to them is not enough. But talking to them is an opening. I would use that opening to encourage them to seek professional help, and I would use that opening to link them to professional care, so that if there are services in your environment, in your college, in your estate, linking this person to care would be the best thing you can do for them. Even when they're reluctant to seek care, encouraging them to seek care, sitting with them when they go to seek care would be an important thing to do. How do we reduce stigma, especially for men? Again, I have said, we have to start thinking about a new view of persons that is all-encompassing, that brings men and women as persons worthy of dignity, worthy of respect, and that when they get unwell, there are services available to them equally that do not discriminate and do not have different expectations for the different genders as far as mental illness and care is concerned. Concerning anxiety in children, I agree we haven't spent a lot of time on this, and as Joy says, we might need to just have a special session on some of the challenges children are facing. But children do experience anxiety. It's just that they present differently. You will appreciate that young children do not have the language to express anxiety, to say, I am afraid, I am anxious, and so on. So instead, it might manifest physically. You might see changes in behavior. You might see them, changing their eating patterns. You might see them changing their sleeping patterns. You might see them getting more and more irritable and restless. And you might see them having physical complaints more, like abdominal pains, headaches, backache, things that are indistinct, but then that are suggesting that there's distress and I do not know what it is, but I need help with this distress. So when that happens, first aid for the family is to ensure that the home environment is safe and to reassure the children that they're in a safe environment despite what is going on out there, and that they would be protected, and that if anything goes wrong, there is help available. And if these symptoms persist and start becoming disabling for the child, getting them to a mental health professional is something that the family would do in order to provide help for the child.
All right, thank you so much, Prof. Then we have, I think this will be the final round of questions we have. So Noah is saying he appreciates the presentations, and he has a question on the issue of legalizing marijuana, and he wants he's asking if you feel that's the best way forward, because he's saying we have some policy makers arguing for legalization of drugs such as marijuana in order to promote safe consumption. Do you think this is the best way forward? And then Philip is asking, what advice would you give to a family reeling from the death of one of theirs to help them cope mentally and emotionally? So any of you can respond to that. And then Abdirahman appreciates the presentations, and he notes, it is good to note that there is a call center support for health workers by health workers. It would be good if the center is made to operate 24 hours, given the current situation and health workers are at the front line at any given time. I understand there are resource constraints, but still comes out as a strong priority. Secondly, would the center mind collecting some of the concerns and information coming through and put out those that are related to policy incoherence and operational failures, lack of information to health workers, amongst others? This may scale up overall accountability and transparency. And he also says, including all success stories. So if we can have a response to that, and then as we respond, Prof, you can give your final remarks, and then Dr. Joy can also give the final remarks. So we'll start with Dr. Joy.
Thank you very much, and thanks for the question in terms of the call center. Yes, we have a research arm, and this is being run by Prof on his end. The research arm is supposed to look at what we derive from this call center, what we also derive from the weekly webinars, and be able to address matters, policy matters, further research, and also how we can further implement better wellness programs within our workplaces. So yes, there is research that will be ongoing using the data that we do collect from those findings, but we are also cognizant that the 8 to 6 p.m. is too short, but we will scale this up. It is just for a short period as we learn how the system goes, and then we scale it up to 24 hours. Thank you. And as we go off from this webinar, I would like to advise all that are out there, remember the protection measures that you have to put in place. Wear your mask, hand washing, social distancing, and know your risk. Know your risk because you are on your own. You cannot cross the road when you're seeing a truck coming at 100 km per hour. You know your risk, know when to cross. Know that, yes, COVID is real. It is here with us. manage your mental health, ensure you're doing something different, paint, do your stitching, take up something different, and do not wallow on that 2020 has burnt out. It's not burnt out. We've got 6 more months to do something. At the end of the day, when we cross over to 2021, don't regret that you didn't do something of value. Thank you, Winnie. Back to you.
Thank you. Thank you, Joy, for those words. There are questions about legalizing marijuana. So my view has been very public and is very well known that I do not believe that we can deal with the problems around harmful substance use by criminalizing them. I think harmful substance use, which harms individuals, is a health problem, is a social problem that we need to design solutions for that put the individual at the center of those solutions. And we cannot treat substance-related problems in jail. We can treat them in hospitals and in rehabilitation facilities and in society by discouraging people from using those substances. So rather than talking about legalizing, because I do not know what that means really, I talk about decriminalization of use. So if you find somebody using a substance that is harmful to them, you do not criminalize them, but you provide them with resources for help so that they can be helped to stop using those substances and to live a healthier and happier life. So whether it is marijuana, criminalizing its use has been shown to be harmful. We are filling jails with people who are mentally ill and who are using marijuana as a form of self-medication. Instead of getting them to hospital, we are sending them to jail. So yes, I am a proponent of removing harmful substance use from the statute books of the penal code and taking it into its proper locale, which is in the health sector, and finding solutions for them that will reduce this harmful use. Legalizing use, suggests that you write in the law that people should be using it. That's not something that I would want to support, but decriminalizing is what I stand for. Whether it is, if you find somebody using heroin, instead of sending them to jail, you should send them to a rehab program that helps them to stop using heroin. As for dealing with those who sell things that society has decided should not be sold, that can be a legal issue. For dealing with the people who push those drugs, people who supply those drugs, you can deal with those in a legal way. But when you find a user, getting them help should be the priority. How to support families reeling from death of a loved one at this time? I think the most important thing is to provide a safe environment for a family to grieve the loss of their loved one. Going through the process of grief is important in processing it in order for it to become a memory in which you can remember the good things about the individual rather than remembering the period of death of that individual. So there are resources out there in the mental health world to support people who have lost a loved one and need a shoulder to cry on, need a place that is safe for them to express their grief. If that is not available within the social circles, within the social network, then there are professionals who can help. But I think in our society, when we lose loved ones, our social circles tend to come together to provide support, both physical and psychological, and to help people walk the journey as they take this person from the point of death to burial and the period after that. So let us take advantage of those resources, whether it is our communities, whether it is the spiritual communities that people have, whether it is social networks that they have built with friends and workmates. Let us take advantage of those to deal with this crisis. I appreciate there's a journalist who has pointed out that journalists are also having a rough time on the front line. They're dealing with pay cuts. Some of them are being fired using SMSs. I would encourage employers, all employers, including employers of journalists, to be more humane as they deal with their employees. Even if they're suffering constraints in the time of coronavirus, they should be humane with their employees because coronavirus will come and go. But you will want your business to survive coronavirus, and you will need these people that you're firing by SMS to maintain your business and to keep it going. Find more humane ways of supporting them, find more humane ways of letting them go, and find humane ways of remaining connected with them so that when you need them, they can also come back to support you. I think there are many other questions that have been asked that we might not be able to answer. The question about there being a sense that we have been asleep at the wheel as third world nations and so on and so forth. I can tell you, I mean, governments will have trouble because of COVID-19. There's no government at this time that anyone can point at and say, oh, you have handled this perfectly 100%, because it is only at this time that you will think they've handled well. Next month, things might be different. There are governments that you might say they have handled it very badly now, but 1 month down the line, they might be looking good. So we do not know who is doing well, who is not doing well. Everybody should be doing the best that they can under the circumstances and based on the resources they have available to them. As I conclude, I have a few words that I would like us to go home with. First, I would like us to just be kind with one another. Let us just, try and do the best we can to understand that everybody is going through a rough time, and be kind as we interact. Let us find reasons to be happy. Let us find reasons in our environment, no matter what is going on, to find some happiness. And then finally, because we are looking at a future after COVID or a future with COVID and so on, let us not sit down and wait for that future to happen, because that will increase our anxiety and cause our problems. Let us actively start creating that future. Let us actively start living in that future. And in that way, we will be active participants and we will be at less risk of mental ill health than if we just sit down and let that future come at us. So if you participate in the formation and the creation of the future after this pandemic, you are less likely to have mental problems than if you're a passive participant and you sit back and wait for it to happen to you. Thank you very much for giving me the opportunity to speak with you today, and I look forward to continuing to having these conversations in future.
All right, thank you so much, Prof, for that, Professor Lukoye and Dr. Joy, for availing yourselves today and for encouraging us through this pandemic, and for just giving us insights that at the end of the day, it's okay not to be okay, and there's always a way out. We have to reach out, we have to look out for each other, and just encourage each other through this pandemic, because it's not affecting one person, it is a global pandemic affecting everybody in this globe. So regardless of where we are, regardless of what we are going through, it is going to be okay. There is some light at the end of the tunnel. Let us keep hope alive and let's hold each other's hands through this pandemic. So we are very grateful to Prof and for Dr. Joy for making time for us. And at this point, even as we close, I would like to request all of us, if you don't mind, let's have our cameras on. If you don't mind, please. Let us turn on our cameras. I can see Dr. Joy. Let's just have all our cameras on. And let's do this for the doctors and for ourselves, and let's keep hope alive and encourage each other with a clap to the doctors and to ourselves for coming this far. At the IEA, we are very grateful to be holding these webinars and for giving insights all through, and we will continue to do this for us and for you. And if you feel there is an area that you feel we need to address, please feel free to write to us at the IEA, and we will ensure that we get the right people to speak to us, and we will, of course, continue these conversations even after COVID, and we're in this together. So feel free to send us those emails on these topics that you want us to cover. And Mr. Kwame Owino, our CEO, is here. So as I close, I'd allow him 1 minute to say hi, and then we close. Thank you so much.
Okay, thank you very much, Winnie. Thanks a lot, Dr. Lukoye and Dr. Joy Mugambi. We appreciate that you've taken time to advise us. I think this is typical. This is not typical of the kind of webinars we hold, but I think it's a significant one. And the fact that we had quite a good audience suggests that this is an important matter. So I thank you all and continue to encourage you. Of course, you're in a profession that's right on the front line right now in many ways, not just in terms of taking care of the physical needs, but also the mental health needs of all Kenyans. So thanks for being here with us, and for the rest of us who are all here, We thank you and hope that you'll join us in our future webinars again. Thank you very much. Bye.
All right.
Thank you.
So
Bye-bye.
All right. So thank you, everyone. We'll see you next time, and look out for our other webinars. Thank you.
Thank you. Thank you.